grandparents taught that this is a great land and it's worth and a very great privilege to be part of that. My oldest son, Joy, and I, my wife, who's in the back of the room joining me today, we're proud parents of 4 children, and our oldest son is a graduate of West Point and trained at Walter Reed and is interning now at Tripler Army Hospital. And he's going to make his career serving the men and women of our armed services. By background, Joy and I have been married for almost 30 years, and we're the proud parents of 4 children who've grown up and been educated in the local public school system of Butler Middle, and Brighton High School. I was educated at Stanford. I did my medical school at the University of Washington, and I did residency here at the University of Utah, and I've been here ever since then. I'm board certified in family practice and also in emergency medicine. And I work in the emergency department at St. Mark's Hospital, which is where I was earlier this week, which is where I'll be tomorrow. And I'm grateful to do that because it's a wonderful opportunity to serve, to treat patients of all backgrounds. You know, one of the things I see in the ER, not only sick and injured people, but I see people who have no insurance, people who are on Medicare, people who are on Medicaid. And one of the great issues that we have facing us is just that, access. Why do people have to come to an ER to be treated? Well, naturally, you come there because you're sick, right? But also, sometimes you come there because you have no other place to go. And that's one of the great things that we need to work on. I was department chairman there for over 12 years and grew that department from 6 doctors to over 23. We see 45,000 patients a year. We just merged our group with another larger group. And we now have 9 hospitals on the Wasatch Front. We see over 200,000 emergency patients every year. Now, that tells you a little bit that I know how to run both an emergency practice and a medical practice, but also work with business and with how to maintain a salary, benefits, and a payroll. And so that's one of my real concerns. And one of my dedications is to keep our group going and understanding the business. I'm a strong proponent of public education. Our children are a product of education, and I was endorsed by the Canyons District as well as the UEA because I believe in small classroom sizes and also adequate funding for education. I'm happy to discuss with you on the sidebar further ideas on that because that is a priority. And lastly, let me just say, yesterday morning I was a featured panelist on the Governor's Healthcare Task Force on reform of our healthcare system. And specifically, I talked about medical liability reform and how we can make that better, fairer, and smarter for all of the patients. You know, we don't want to ruin that very nice relationship between a doctor and the patient. But we want to preserve that and go forth with that in a very positive way, but still protect our patients in a way that they receive compensation when their errors happen. And they do happen, and we own that. But there's ways to do it that will keep down defensive medicine costs, keep down the cost of medical care. And frankly, right now, you know as well as I know that the healthcare costs in this country, even though I firmly believe in our state, we have the finest healthcare in this country, it's too expensive. You can't afford to go to your doctor's office, and you certainly can't afford to go to the emergency department. That's one of the great things I want to work with the legislature, and I take that expertise up. Now, I have a number of bills that we sponsored and I helped pass this last year in the state legislature that dealt with things like public health care, preventative health care, and physician-patient relationships. And I bring that combination of business practice, medical expertise, a fondness, and a dedication to education to this job, and that's my place to work well. Thank you very much.
Thank you very much. You alluded to education funding. I'm going to ask some of the questions to let us know what your thoughts are on how we can help.
You know, I want to tell you up front, if this were an easy task, this question would have been asked and answered long ago. Because you know as well as I know, our WPUs are the lowest in the country. And that's despite the hard work of the state legislature in trying to do that. And that's probably because of a number of factors. But one is that we have a very young, growing population. And another is that we have, as a state, mandated a balanced budget. And we've tried as a state to keep taxes down. So that's a real challenge, isn't it? How do we fund education, do it responsibly, and yet still deal with those issues of funding? One of the things that I would like to do would be first, in terms of the funding of education, let's look back in the 1990s when we had that constitutional amendment that changed the allocations between higher education and K through 12 education, because that really did change the landscape of things. I think that's one area that we can clearly look at. We always, as a state, look at, and frankly as parents, we have to look at efficiencies within our own schools. Look, none of us want unsafe schools. None of us want huge classrooms. But let's also look legitimately at efficiencies in our schools and make sure we're using our dollars that we allocate to them also very responsibly. You know, the state is using some federal land swaps that have generated millions of dollars every year to the funding of our education. And that is an immediate benefit to our children. It's not something that might be philosophically attractive, but it's still off in the future. But something that gives us immediate revenue for our schools, which is so valuable. And then lastly, just let me conclude with one thing. You know, as a doctor, we learn to add and subtract early on in our careers, and I think we need good numbers. I think we need to know how many students we're dealing with. I think we know then we can talk about what is really adequate funding. But until we get a handle on that, we have to know what our number is so we can take care of our kids.
Okay, is there time for another one? Yes. Oh, we do have time for another one. Okay, can you give us your thoughts then on the public land issue? That seems to be a hot topic right now.
Well, again, I alluded to that briefly in my remarks. And let me just tie that back into something, if I may. And I'm not dodging this. You know, one of the things, what is the biggest thing you see as the duty of the legislature? Well, it's really appropriations, isn't it? I mean, really. And so what is the challenge that we're going to have to do? When we talk about the Affordable Care Act, and that, as it comes to us as a people, that's one of the huge historic items that we're ever going to face. You know, there hasn't been a bigger, more important issue faced us in decades. This path that we take at this time in our lives will determine a great deal whether we create a socially an entitlement program that may cost us millions and millions of dollars. And then we need to be able to make sure that it's sustainable. What I don't want to see is taking money from our education to fund a program. And I would love to have more of a sidebar on this with you, because as former president of the Utah Medical Association, we had to take a stand on this to discuss the expansion of Medicaid and how we're going to take care of patients who don't have insurance, who don't have access. These are some of the hot topics that need to be done, and still balance that and go forth with a balanced budget. So those are some of the issues that I would like to address, and I bring that unique expertise. And frankly, those are the issues of the day. When you look at whoever you choose on the national, on the state, or on the local level, I think you have to ask yourself a couple questions. One, who has the knowledge and the background to weigh in on these issues? Number two, who will be effective on the Hill in bringing these issues into a very fair, bipartisan solution, so that it's not just one party or another party, but the best solution for this great state of Utah. And that's what I want to take up to the Hill. I've been able to collaborate with trial attorneys. You want to know what that's? Try collaborating with a trial attorney when you're an emergency dog. That brings a whole new sense of let's get together and talk. And I've been able to do that in our new innovative early resolution dispute program that we're going to launch as a method to reduce defense and domestic costs. So that's an opportunity I invite, and I'm looking forward to serving with you. Thanks so much for your time, ladies. I appreciate that. Thanks.